Hello everyone. Today we are going to discuss about one of the most important procedure of medical equipment or medical terminology, which is known as ICD, or I can say intra-costal drainage. What actually it is? If you want to discuss in length, you have to discuss in small part. For example, if I discuss about what is intra-costal drainage, first you have to know what is it actually. It actually says tube, which is a catheter inserted through thoracic cavity to remove the air and the fluid from the pleural space to prevent air or fluid from re-entering back into the pleural space. On other sense, you can say to re-establish a normal intrapleural or interpulmonary pressure. This is known as actually in a small brief about intercostal drainage. Okay. Second thing is about the purpose of intertube placement. Why it is required? What is the necessary of it? It is necessary actually to remove the fluid and air properly or promptly as possible. Second thing is that to prevent the drained air and fluid from re-entering back into the pleural space. Second point. Third point is that to restore the negative pressures in the pleural space to expand the lung. There is a third point why this chest tube should be placed. Okay. The most important thing is that material or the equipments required to start this procedure. First thing is that you have to know about the thoracotomy or chest tube insertions trays. That is most important thing. Second thing about the oxygen source, suction, emergency equipment that must be nearby at your hand. Second, and based on this point only, you have to remember one thing that 16 to 20 size of French catheter is inserted for air or serous drainage. Second thing is that from 28 number to 40, which is inserted for serous, which should be thick or purulent drainage. Those things should be kept in the mind. But next one is you have to based on the point that how it works. It keneke kaam kore? It ki kore? It expands out expiratory pressures which help to push air and fluid out. Right. Second point is gravity. What is it? It helps to fluid drainage as long as chest drainage is below the level. That need to be kept in the mind. Third point is suction, which can improve the speed or which on which the air and the fluid are pulled out from the chest. That is the third point. Before you start the procedure, you have to know আমি কিছুমান আনুষঙ্গিক কিছুমান কাম কৰি ল'ব লাগে, right? So সেই আনুষঙ্গিক কামবোৰ কেনেকুৱা হ'ব? First of all is you have to identify the patient who would be suffering from disease. Second thing is that to monitor the vitals of the patient. Patient's vitals can check কৰি ল'ব লাগিব. Third thing is that to explain about the procedure to explain কৰিব লাগিব patient. Third and fourth point is that to inform the consent and procedure consent, which is very important. Patient's consent ল'ব লাগিব, even the one who is attending him or her. Especially it should be taken in the written. That is most important. And not the least, the fifth point about the pre-procedure is preparation by articles in the environment. That environment to create by yourself, right? Next, when you go to the procedure point, you means the procedure koribole jaba ki bostu lagibo. Information the consent, that is very important. It should be in written document. That is also very important. Second point is that you have to set up prescribed system. You have to set up first. Third and most important point, that is a very vital point, which I feel like so, that is called the washing of the hands and applications of gloves on your hands. This is very important. Fourth point, you have to administer a pre-medication as ordered. As has been ordered, you have to do that. Fourth and fifth point is that assist the physician attach drainage system tube to the chest tube. That is important, right? Without that one, you will not be able to help out, right? Next আমি গলো post procedure কৰাৰ পাছত কি কৰিবা? Then কি কৰিব লাগিব is that you have to monitor the patient vitals and comfort. That is important. Second is replace the articles and recording of the reporting. That is very important. Report খিনি record কৰিব লাগিব, তাৰ ওপৰত articles whatever is going on with the patients that you have to record in, especially in documentation if required. Special documentation is required, হেতু কৰিবই লাগিব. Third point is that assess the pain by pain scale management. That is important for you all to do it in large scale basis. If you are getting it one patient or two patient, that have to keep precautionary measures, right? Most important precaution is that clamping a chest tube is contracted when ambulation or transporting a patient. Clamping might lead to tension pneumothorax. That is very important. Keep in the mind that clamping should not take place. What are the special considerations you have to keep in the mind while doing this one? First of all, watch for a fluctuation. Fluctuations hoise na nai etu sabo lagibo. That is tidalling or fluid level, which you all know. While you have done your nursing, you are well aware of this one. Second thing is that if the fluctuating is less than 2 centimeter locked up blockage, you should lock the blockage. If blockage is present, milking is done. Immediately do the milking. Fourth point is that make sure the connections are tight and tapped. That is very important. See it properly. Fifth point is that report any unexpected cloudy or bloody drainage system is going on with the patient. If it goes on, assess the dressing system, and if any exclusion is present, send immediately for culture. That you should keep in the mind. This is the most vital point that special consideration have to keep in the mind while going on through this type of procedures. Okay. What are the basic nursing system that you keep in the mind? First thing is that you have to keep the drainage system 2 or 3 feet below the patient's chest. Etu hodai mont rakhiba. Jetia drainage system to koriba, hetu 2 বা 3 feet patientor chestor tolot jaya thake. Second point is that keep the tubing patient to make sure no clots take place. Clotting should not take place. You have to be very sure about it. Third point is observe and record amount of drainage system. If it is if it is above 100 cc, then immediately report to the physician. Fourth point is that encourage TCDB ambulation if ordered. Okay, you know it about like TCDB, right? That's the terminology which you all got while you were doing your nursing, right? TCDB means what? If you have remembered, turn, cough, deep breath, right? That should be propagated by you, or it should be administered by you. You should administer it so that the patient doesn't get any problem. This is a basic thing that you should know while we are doing. See, last one is known as termination. While terminating the equipment, you have to first explain the procedure. Yeah, the last is termination. While termination, keep in the mind that you have to explain the procedure first. Equipments, what are required? That is, as you know, removable kit is required, glove is required, Vaseline gauze is required, 4x4 tap, towels, these things are required for terminations. Again, what is required? Tube should be pulled at the end of full inspiration. Some physicians prefer coughing also, because why? Holding the breath also, so that it can increase the intrathoracic pressure. So it can increase the thoracic pressure, so that patient will get less pains. Take it hard, and most important point is always you go for occlusive dressing. That is important for you all, right? We all know about it, you all got it. Just I made it explain to you so it becomes easy to you to understand it in a more better way. Last but not least, what are the cares that you should take? I mean, can care lobo lage. First of all, we should always encourage our patient to cough, deep breathe, and use the incentive spirometer. That is very important. I mean, ki koribo lagibo? We should ask them to cough, to take deep breath, and use the incentive spirometer, which you all know, right? Second thing is that we should advise for ROM if not contraindicated, if not required, and advise for ROM. Okay. Our third point to ki hall, routinely you should assess to respiratory rate. Respiratory rate to thik ase na nai, breathing sound is okay or not, SpO2 level, which you all know, oxygen level is high or low, that should be monitored timely again, right? Timely. Actually, routinely means what? Timely. And not the least but last point is that you should seek the insertion site and skin inspection time to time, right? Being a nurse, we all should keep in everything know about this all, right? But this is just routinely to know you all what are the things required. First of all, what did I say about the caring? We should encourage the patients to cough, to take deep breath, and use of incentive spirometer. Second point is that advice for ROM if not contraindicated. Routinely check the respiratory rate, breath sounds, and SpO2 levels. Fourth point, check the insertion site and skin inspections routinely. These are the things that you all should keep in the mind while going through a patient. Because these are the so small precautionary measures that you should keep in the mind while going through a patient in this way. I hope it will help you in a bigger scale to understand about what actually intra-costal drainage system is about. May I have understood all of you about it. And with this, I'm winding up the class. Thank you.